So what happens if you find out you do have the BRCA gene? And many of us know about Angelina Jolie, who had to make this decision. Eventually, the risk of developing breast cancer, if you're either positive for the BRCA1 or the BRCA2 gene, exceeds 80%. Okay? So at some point, women may want to protect themselves by having their breasts removed, and we call that a prophylactic or protective mastectomy. It does not reduce the risk of cancer to zero, but it certainly reduces it significantly, okay? Probably to about 1 to 2%. Okay? But it's a tough decision, because what if you find out when you're 20 and you know that you have this high risk, but maybe that risk is not that high in the next 5 or 10 years? Now, if I could ask Kelly to come up and talk a little bit. You also work in the field of cancer genetics, and in addition to being a fitness trainer. It would be a tough decision, wouldn't it be, for like a 20-year-old who found out she had the BRCA gene? As a young woman yourself, what kind of struggles would you have with that?
Well, for me personally, the first things that come to mind, because I don't have children yet, and my husband and I are talking about that, would be wanting to, have a family first. And if I'm prophylactically having a double mastectomy or taking out my ovaries, I would worry about my ability to obviously have children and then to breastfeed them, and knowing, the benefits that those children as a nutritionist would have from the positive bacteria and colostrum from breastfeeding, and the omega-3s available in that breast milk as well for their neurological development. And
emotional development, right?
Absolutely.
Bonding, yeah. What this really relates to is what a tough decision it is, okay? And luckily, we have lots of resources, not just through the information we're providing to you today, but through the medical community in general, that can help women make this decision. So thank you for your insight with that.
Sure, absolutely.
What happens when you don't detect breast cancer early enough? And this is a cause that is very, very close to my heart, because I run a breast cancer clinic that focuses on providing care to women that don't have easy access to cancer screening, diagnosis, or treatment. And through a wonderful state program called the Every Woman Counts program, we provide free mammograms to try to keep this from happening. This is an example of a breast cancer that now has spread to the lungs, and you can see the x-ray, you see this big mass in the lung, and eventually that's going to interfere with the patient's ability to breathe and result in death. Okay? So when cancer cells are left unchecked, they move to other places in the body where they disrupt normal physiologic functions. Okay? So I'd like to take this point in time to let you know that there are programs available, especially if you live in the state of California, where there is no reason why lack of financial resources or lack of insurance should keep you from getting a mammogram. And we will put some information up that will show how to access those programs, not just at Valley Breast Care, but throughout the state, that can help provide timely and effective treatment. Early detection relates to yearly mammograms starting at the age of 40. There's been controversy about that, and I won't get into that controversy, but the American Cancer Society, as well as us at Valley Breast Care, believe that a woman should have her first mammogram at age 40 and on a yearly basis. We know that not all cancers are seen on mammograms, and we're big proponents of ultrasound. That's a little more controversial. Not everybody feels that women should also have a yearly ultrasound. In some states, however, it is mandated, especially in younger women with a family history of breast cancer, because younger women, they have more dense breasts. Okay? As we age, our breasts are replaced with fatty tissue, which makes it easier to see a cancer on a mammogram. But in a young 38-year-old woman, it's hard to see a cancer on a mammogram, and ultrasound can really be a complementary test. Okay? So if I have a woman that has a sister who had breast cancer at age 35, I'll say, why don't we do this? Let's get your mammogram every January, but let's do an ultrasound every June. So we increase our chances of detecting it at an earlier stage. Okay? So to qualify for the Every Woman Counts program, you come in, you fill out a questionnaire. It's based on income, limited resources, but the program is designed to facilitate, not to inhibit women from getting access to breast cancer screening. And it's so sad when I see a patient who comes in with a cancer that's already spread, and I say, why didn't you take advantage of this life-saving program? And they say, I just didn't know. And part of the reason why we've all gathered here together is to increase that awareness that we can use the tools that we already have in our arsenal to fight breast cancer. We don't need to necessarily put resources into research, although that's very important. We already have the tools that can save lives if we can just get the word out. Okay? And at the end of this session, information will be put up that can show you how you can access this program and other programs that can help you get yearly mammograms and other services related to breast cancer prevention.